Psychiatric Q&A. Part 4. 91. The nursing assistant tells Nurse Ronald that the client is not in the dining room for lunch. Nurse Ronald would direct the nursing assistant to do which of the following? A. Tell the client he'll need to wait until supper to eat if he misses lunch. B. Invite the client to lunch and accompany him to the dining room. C. Inform the client that he has 10 minutes to get to the dining room for lunch. D. Take the client a lunch tray and let the client eat in his room. The answer is B. Invite the client to lunch and accompany him to the dining room. The nurse instructs the nursing assistant to invite the client to lunch and accompany him to the dining room to decrease manipulation, secondary gain, dependency and reinforcement of negative behavior while maintaining the client's worth. 92. When taking a health history from a female client who has a moderate level of cognitive impairment due to dementia, the nurse would expect to note the presence of A. Accentuated premorbid traits. B. Enhance intelligence. C. Increased inhibitions. D. Hypervigilance. The answer is A. Accentuated premorbid traits. A moderate level of cognitive impairment due to dementia is characterized by increasing dependence on environment and social structure and by increasing psychologic rigidity with accentuated previous traits and behaviors. 93. The primary nursing diagnosis for a female client with a medical diagnosis of major depression would be A. Situational low self-esteem related to altered role. B. Powerlessness related to the loss of idealized self. C. Spiritual distress related to depression. D. Impaired verbal communication related to depression. The answer is D. Impaired verbal communication related to depression. Depressed clients demonstrate decreased communication because of lack of psychic or physical energy. 94. Nurse John recognizes that paranoid delusions usually are related to the defense mechanism of A. Projection. B. Identification. C. Repression. D. Regression. The answer is A. Projection. Projection is a mechanism in which inner thoughts and feelings are projected onto the environment, seeming to come from outside the self rather than from within. 95. Nurse Tony should first discuss terminating the nurse-client relationship with a client during the A. Termination phase when discharge plans are being made. B. Working phase when the client shows some progress. C. Orientation phase when a contract is established. D. Working phase when the client brings it up. The answer is C. Orientation phase when a contract is established. When the nurse and client agree to work together, a contract should be established. The length of the relationship should be discussed in terms of its ultimate termination. 96. The initial nursing intervention for the significant others during shock phase of a grief reaction should be focused on A. Presenting full reality of the loss of the individuals. B. Directing the individual's activities at this time. C. Staying with the individuals involved. D. Mobilizing the individual support system. The answer is C. Staying with the individuals involved. This provides support until the individual's coping mechanisms and personal support systems can be immobilized. 97. Tina with a histrionic personality disorder is melodramatic and responds to others and situations in an exaggerated manner. Nurse Trish would recommend which of the following activities for Tina? A. Baking class. B. Role-playing. C. Scrapbook making. D. Music group. The answer is B. Role-playing. The nurse would use role-playing to teach the client appropriate responses to others and in various situations. This client dramatizes events, drawn attention to self, and is unaware of and does not deal with feelings. The nurse works to help the client clarify true feelings and learn to express them appropriately. 98. Grace is exhibiting withdrawn patterns of behavior. Nurse Johnny is aware that this type of behavior eventually produces feeling of A. Repression. B. Loneliness. C. Anger. D. Paranoia. The answer is B. Loneliness. The withdrawn pattern of behavior prevents the individual from reaching out to others, for sharing the isolation produces feeling of loneliness. 99. A male client who is experiencing disordered thinking about food being poisoned is admitted to the mental health unit. The nurse uses which communication technique to encourage the client to eat dinner? A. Focusing on self-disclosure of own food preference. B. Using open-ended question and silence. C. Offering opinion about the need to eat. D. Verbalizing reasons that the client may not choose to eat. The answer is B. Using open-ended question and silence. Open-ended questions and silence are strategies used to encourage clients to discuss their problem in descriptive manner. 100. Mario is admitted to the emergency room with drug-included anxiety related to overingestion of prescribed antipsychotic medication. The most important piece of information the nurse in charge should obtain initially is the A. Length of time on the med. B. Name of the ingested medication and the amount ingested. C. Reason for the suicide attempt. D. Name of the nearest relative and their phone number. The answer is B. Name of the ingested medication and the amount ingested. In an emergency, life-saving facts are obtained first. The name and the amount of medication ingested are of utmost importance in treating this potentially life-threatening situation. 101. A characteristic that would suggest to nurse and that an adolescent may have bulimia would be A. Frequent regurgitation and reswallowing of food. B. Previous history of gastritis. C. Badly stained teeth. D. Positive body image. The answer is C. Badly stained teeth. Dental enamel erosion occurs from repeated self-induced vomiting. 102. A 23-year-old client has been admitted with a diagnosis of schizophrenia. Says to the nurse, "Yes, it's March. March is little woman." That's literal, you know. These statements illustrate A. Neologisms. B. Echolalia. C. Flight of idea. D. Loosening of association. The answer is D. Loosening of association. Loose associations are thoughts that are presented without the logical connections usually necessary for the listening to interpret the message. 103. Nurse Monette recognizes that the focus of environmental milieu therapy is to A. Manipulate the environment to bring about positive changes in behavior. B. Allow the client's freedom to determine whether or not they will be involved in activities. C. Role-play life events to meet individual needs. D. Use natural remedies rather than drugs to control behavior. The answer is A. Manipulate the environment to bring about positive changes in behavior. Environmental milieu therapy aims at having everything in the client's surrounding area toward helping the client. 104. Nurse Tina is caring for a client with delirium and states that look at the spiders on the wall. What should the nurse respond to the client? A. You're having hallucination, there are no spiders in this room at all. B. I can see the spiders on the wall, but they are not going to hurt you. C. Would you like me to kill the spiders? D. I know you are frightened, but I do not see spiders on the wall. The answer is D. I know you are frightened, but I do not see spiders on the wall. When hallucination is present, the nurse should reinforce reality with the client. 105. Marco approached Nurse Trish asking for advice on how to deal with his alcohol addiction. Nurse Trish should tell the client that the only effective treatment for alcoholism is A. Psychotherapy. B. Alcoholics Anonymous, AA. C. Total abstinence. D. Aversion therapy. The answer is C. Total abstinence. Total abstinence is the only effective treatment for alcoholism. 106. Which of the following would Nurse Hazel expect to assess for a client who is exhibiting late signs of heroin withdrawal? A. Yawning and diaphoresis. B. Restlessness and irritability. C. Constipation and steatorrhea. D. Vomiting and diarrhea. The answer is D. Vomiting and diarrhea. Vomiting and diarrhea are usually the late signs of heroin withdrawal, along with muscle spasm, fever, nausea, repetitive, abdominal cramps and backache. 107. A neuromuscular blocking agent is administered to a client before ECT therapy. The nurse should carefully observe the client for A. Respiratory difficulties. B. Nausea and vomiting. C. Dizziness. D. Seizures. The answer is A. Respiratory difficulties. Neuromuscular blocker, such as acetylcholine, anectine, produces respiratory depression because it inhibits contractions of respiratory muscles. 108. When planning the discharge of a client with chronic anxiety, Nurse Chris evaluates achievement of the discharge maintenance goals. Which goal would be most appropriately having been included in the plan of care requiring evaluation? A. The client eliminates all anxiety from daily situations. B. The client ignores feelings of anxiety. C. The client identifies anxiety-producing situations. D. The client maintains contact with a crisis counselor. The answer is C. The client identifies anxiety-producing situations. Recognizing situations that produce anxiety allows the client to prepare to cope with anxiety or avoid specific stimulus. 109. Nurse Perry is aware that language development in autistic child resembles A. Scanning speech. B. Speech lag. C. Stuttering. D. Echolalia. The answer is D. Echolalia. The autistic child repeats sounds or words spoken by others. 110. Nurse Maureen is developing a plan of care for a female client with anorexia nervosa. Which action should the nurse include in the plan? A. Provide privacy during meals. B. Set up a strict eating plan for the client. C. Encourage client to exercise to reduce anxiety. D. Restrict visits with the family. The answer is B. Set up a strict eating plan for the client. Establishing a consistent eating plan and monitoring client's weight are important to this disorder. 111. Nurse Joey is aware that the signs and symptoms that would be most specific for diagnosis anorexia are A. Excessive weight loss, amenorrhea and abdominal distension. B. Slow pulse, 10% weight loss and alopecia. C. Compulsive behavior, excessive fears and nausea. D. Excessive activity, memory lapses and an increased pulse. The answer is A. Excessive weight loss, amenorrhea and abdominal distension. These are the major signs of anorexia nervosa. Weight loss is excessive, 15% of expected weight. 112. Chris periodically has acute panic attacks. These attacks are unpredictable and have no apparent association with a specific object or situation. During an acute panic attack, Chris may experience A. Heightened concentration. B. Decreased perceptual field. C. Decreased cardiac rate. D. Decreased respiratory rate. The answer is B. Decreased perceptual field. Panic is the most severe level of anxiety. During panic attack, the client experiences a decrease in the perceptual field, becoming more focused on self, less aware of surroundings and unable to process information from the environment. The decreased perceptual field contributes to impaired attention and inability to concentrate. 113. Which of the following best explains why tricyclic antidepressants are used with caution in elderly patients? A. Central nervous system effects. B. Cardiovascular system effects. C. Gastrointestinal system effects. D. Serotonin syndrome effects. The answer is B. Cardiovascular system effects. The TCAs affect norepinephrine as well as other neurotransmitters, and thus have significant cardiovascular side effects. Therefore, They are used with caution in elderly clients who may have increased risk factors for cardiac problems because of their age and other medical conditions. The remaining side effects would apply to any client taking a TCA and are not particular to an elderly person. 114. Propranolol, Inderal, is used in the mental health setting to manage which of the following conditions? A. Antipsychotic, induced akathisia and anxiety. B. Obsessive-compulsive disorder, OCD, to reduce ritualistic behavior. C. Delusions for clients suffering from schizophrenia. D. The manic phase of bipolar illness as a mood stabilizer. The answer is A. Antipsychotic, induced akathisia and anxiety. Propranolol is a potent beta-adrenergic blocker and producing a sedating effect, therefore it is used to treat antipsychotic-induced akathisia and anxiety. 115. A nurse who explains that a client's psychotic behavior is unconsciously motivated understands that the client's disordered behavior arises from which of the following? A. Abnormal thinking. B. Altered neurotransmitters. C. Internal needs. D. Response to stimuli. The answer is C. Internal needs. The concept that behavior is motivated and has meaning comes from the psychodynamic framework. According to this perspective, behavior arises from internal wishes or needs. Much of what motivates behavior comes from the unconscious. The remaining responses do not address the internal forces thought to motivate behavior. 116. A client with dysthymic disorder reports to a nurse that his life is hopeless and will never improve in the future. How can the nurse best respond using a cognitive approach? A. Agree with the client's painful feelings. B. Challenge the accuracy of the client's belief. C. Deny that the situation is hopeless. D. Present a cheerful attitude. The answer is B. Challenge the accuracy of the client's belief. Use of cognitive techniques allows the nurse to help the client recognize that this negative beliefs may be distortions and that, by changing his thinking, he can adopt more positive beliefs that are realistic and hopeful. Agreeing with the client's feelings and presenting a cheerful attitude are not consistent with a cognitive approach and would not be helpful in this situation. Denying the client's feelings is belittling and may convey that the nurse does not understand the depth of the client's distress. 117. Which of the following statements should be included when teaching clients about monoamine oxidase inhibitor, MAOI, antidepressants? A. Don't take aspirin or nonsteroidal anti-inflammatory drugs, NSAIDs. B. Have blood levels screened weekly for leukopenia. C. Avoid strenuous activity because of the cardiac effects of the drug. D. Don't take prescribed or over-the-counter medications without consulting the physician. The answer is D. Don't take prescribed or over-the-counter medications without consulting the physician. MAOI antidepressants, when combined with a number of drugs, can cause life-threatening hypertensive crisis. It's imperative that a client checks with his physician and pharmacist before taking any other medications. 118. Discharge instructions for a male client receiving tricyclic antidepressants include which of the following information? A. Restrict fluids and sodium intake. B. Don't consume alcohol. C. Discontinue if dry mouth and blurred vision occur. D. Restrict fluid and sodium intake. The answer is B. Don't consume alcohol. Drinking alcohol can potentiate the sedating action of tricyclic antidepressants. Dry mouth and blurred vision are normal adverse effects of tricyclic antidepressants. 119. Before helping a male client who has been sexually assaulted, Nurse Maureen should recognize that the rapist is motivated by feelings of A. Hostility. B. Inadequacy. C. Incompetence. D. Passion. The answer is A. Hostility. Rapists are believed to harbor and act out hostile feelings toward all women through the act of rape. 120. Which activity would be most appropriate for a severely withdrawn client? A. Art activity with a staff member. B. Board game with a small group of clients. C. Team sport in the gym. D. Watching TV in the day room. The answer is A. Art activity with a staff member. The best approach with a withdrawn client is to initiate brief, non-demanding activities on a one-to-one basis. This approach gives the nurse an opportunity to establish a trusting relationship with the client. A board game with a group clients or playing a team sport in the gym may overwhelm a severely withdrawn client. Watching TV is a solitary activity that will reinforce the client's withdrawal from others.